Member for Lanark, Frontenac, Kingston.
Speaker, my question is to the Minister of Long-Term Care. During a state of emergency, all executive powers rest with the Premier. As the deaths in long-term care began to mount in April, the OMA offered to assist. The OMA assistance included setting up mobile testing centres at our LTC homes, and they would provide doctor-led medical support using physicians that were now inactive because of the emergency orders. These proposals were all rejected prior to April 22. The rejection puzzled many of us. Speaker, my question to the Minister is, when was the OMA offer initially made, but more importantly, who rejected it? Was it the Minister, the Premier, or the COVID command table?
Minister of Long-Term Care.
Thank you, Speaker, and thank you for the question. Looking at the process by which we began to plan and respond to COVID-19, a worldwide pandemic with a devastating effect in long-term care across the world, we worked with the Ministry of Health, we worked with the command table. There was an integrative process with Ontario Health and Ontario Health teams and many, many partners to put together a response for our long-term care homes. I know physicians, many of them, involved in the long-term care homes, on the front lines, participating. So I know that physicians were involved not only in long-term care, but across the hospitals in terms of planning and organizing. So I want to make sure that the member opposite understands we've reached across the spectrum for all levels of assistance. And I want to assure you that the physician and medical expertise has been valued, as has the nursing expertise, as has been our PSWs, and everyone else who is contributing to the understanding of COVID-19.
Thank you. The supplementary question.
Again to the Minister. On March 13th, we had 79 cases in LTC. 4 days later, that number was 189, still mostly in long-term care, and the state of emergency was declared for 14 days. On March 26th, the command table resisted testing everyone in LTC. And by April 1st, we had 40 deaths in our LTC homes. And by the time the OMA, the specific OMA proposal to help was rejected, the number of deaths had risen to 500 in long-term care. The need for help was clearly evident. And you said earlier today that every tool was used, but the OMA tool was not used. There are now over 1,650 deaths in long-term care. Speaker, my question to the Minister is simple. Who made this terrible decision that imperiled the lives of so many? Was it the Minister, was it the Premier, or was it the COVID command table?
Thank you, Speaker, and thank you again to the member opposite for the question. This is an integrated approach, as I've said before, and I will continue to say that until someone understands what that means. It is an integrative response using Ontario Health, the command table, multiple ministries, and looking at how we use all the resources available to us to support our homes. This has been an ongoing process, an integrated process. And as I said, there has been medical assistance through physicians. There has been nursing assistance. We have had portals. We have had the ability to have volunteers. Also, provincial and federal portals. Every tool has been used. And I do not speak specifically to this issue because it was an integrated response. And the command table, it's been very transparent about the command table from the beginning. And we need an integrated response, and that's what that was. Thank you.